His Excellency Sheikh Al-Fatah bin Mohammed Al-Harthi, Secretary General for the Council of Ministers, the 10th Pharmaceutical Care Conference was inaugurated at this time in Oman Convention and Exhibition Centre with the presence of His Excellency Dr. Ahmed bin Mohammed Al-Saidi, the Minister of Health, and senior officials from the Ministry of Health. Our colleague Abdullah bin Ahmed Al-Rabai is there to highlight the importance of this conference. Abdullah, good evening. Tell us about this conference.
Hi, good evening, Stacey. If you can hear me, now we are live actually at the Conventional and Exhibition Center here in Irfan, Madinat Irfan, where the 10th Pharmaceutical Conference under the title Excellence Practice of Pharmaceutical Care is going to be held for a period of 3 days. Now, to learn more on that particular area, we have with us one of the guests. Of course, his name is Derek Stewart, professor from Qatar University, and he is also the president of the European Society for Clinical Pharmacy. Now, let me remind you, this particular conference has been opened under the auspices of chief guest Al-Fadl Al-Harthi. Sheikh Al-Fadl Al-Harthi is actually Secretary General of the Council of Ministers. And right now, the conference program is going on, but here is Professor Derek Stewart. Welcome, Professor Derek Stewart, and tell us about the importance of this particular conference.
I'm really delighted to be back at this conference. This is the third time I've been invited to speak here. It's a really important pharmacy event, nationally, regionally and internationally. It brings together key people around the globe to really speak about advances in pharmacy, particularly about what pharmacists can do and their wider teams for patient care. This is a large 3-day event that's going to focus on research, education and practice, really about putting patients at the centre of that care, and really what the pharmacy team can do around that to support patients. It's particularly important during this global pandemic, where pharmacists and their teams have a really prime role in the delivery of healthcare during difficult times.
Wonderful. What is the most important area that is going to be focused on at this particular conference?
The most important area really is about innovation, new things in pharmacy, how they've been developed, how they've been implemented, how they can be sustained, really about how pharmacy teams, and particularly pharmacists, can work with doctors, nurses, other health professionals, with the patient at the centre of that care, really to improve things for patients. Medication is a huge part of the care that we provide to people. Medicines can be very beneficial, but they can also bring a lot of danger, a lot of harm. And one of the key central things of this conference is around patient safety, which is also a big move within the World Health Organization with a global patient safety challenge.
Talking about patient safety is an important area of any healthcare institutions, and of course medicine or pharmaceutical area is one of the most important areas, as you have indicated there. But during this particular time of pandemic, people are talking about vaccines and the way how it's been delivered. What would you like to talk about?
Yeah, I mean, I think in terms of all healthcare professionals, the main thing about the vaccines is for the public and patients to think about the evidence. We really need to look at the scientific data, which shows us that the vaccines are highly effective, and particularly once you've had 2 doses and the booster dose as well, and the actual harm is very minimal, and most of the studies have shown that the harm will probably come from having the vaccine, from having the actual virus and not the vaccine itself. So we must rely on what we hear from the health professionals who are trained to give that evidence and that information.
Wonderful. Back to you, Stacey there. As you have heard Professor Derek Stewart, who is also the president of the European Society of Clinical Pharmacy, he has talked about the safety of a vaccine, that it's safe and there is no problem at all. This what we need to encourage people to go ahead and continue to take that particular vaccine, especially at this particular time where there is a 3rd dose that needs to be taken by categorized people at this particular moment. Once again, back to you, Stuart, and thank you for Professor here. We will continue to talk to him at a different report later on. Thank you again.